So how do you keep track of what treatment settings are available in your area? And what recommendations do you have for practitioners that live in parts of the country with few to no resources?
I think first and foremost, there are certainly online resources. There's ways to access information through various means online.
Like the SAMHSA treatment locator.
Like the SAMHSA treatment locator. But I think sort of gaining a working knowledge after practicing over time, and a little bit of hearing anecdotally from patients what kind of experiences they've had at certain places, and what kind of places you have good open lines of communication with. Those tends to be the places that, although I may have a comprehensive list, there are going to be a few that seemingly are going to work better for certain patients in my clinical setting. So that's one approach.
I moved to practice once in Massachusetts, and so a completely different location from here. And one of the things that I did when I first got there was first talk to my colleagues to find out where they refer people. And then I did searches and carried a list with myself because I knew the whole treatment setting was going to be completely different, what was available. So I think especially if a provider is moving to a new place, it's incumbent upon them right away to find out what is available.
You kind of have some homework.
Yeah, exactly. Yeah, it's important homework because that's how you can be effective.
And if you work on a collaborative care team, sometimes if you have outreach workers, they hear about places and get back to you. Patients are always a very good resource. Licensed clinical social workers are always on the phone seeking care options. So sometimes you'll just get information from working on a team.
So find the people who already know.
Yep.
Field trips are great, but if not, give a call.
Well, I like Jeanette's idea of listening to your patients. I do find for multiple things that I'm learning so much from my patients, where they've been, what worked, what didn't work, different substances that are being used, how people are using, where they're using. I mean, there's a wealth of knowledge that comes from people who are sort of going to different treatment centers or who are currently using. And beyond patients, I agree. Sort of colleagues, I have a patient I'm needing to send. What have you heard recently about such and such a place? Because even within one facility, people are changing, staff is changing,
Right.
or over time new treatments have become available, or policies have changed. Some programs that may not have previously allowed patients to be on methadone or buprenorphine may now allow them to be. So it's an ongoing and evolving process, I think.
Got to update your resource list.
Yeah.
And I also think we do talk about this in one of our lessons, but there are kind of questions that you can go through to ask if a particular treatment program is providing evidence-based treatment and what wraparound services or aftercare services they might provide, things like that, that can be useful. And you can find those questions online and also in this course.